If you want to find out more about ovulation induction, superovulation, and hyperstimulation, you've come to the right place. Watch this video through to the end. I'm Dr. Malpani. I'm an IVF specialist at Malpani Infertility Clinic. Our website is www.drmalpani.com. And one of the things we're trying to inject into the IVF ecosystem in India is what I call information therapy. How do we make sure that patients understand exactly what doctors are doing? This is great for good doctors. Good doctors want their patients to know what's happening, why they're doing it, because that way they have realistic expectations and they take professional pride in the quality of care which they provide to their patients. Bad doctors feel threatened by well-informed patients. But do you really want to go to a bad doctor? Don't you want to make sure that what your doctor is telling you is the truth? And that's one of the things we're trying to do in this series of videos, to make sure that patients are well informed. Because good doctors will do a good job no matter what. It's bad doctors which give all doctors a bad reputation. So let's start from the basics. And a lot of these terms seem very complex. Large terms, Greek, Latin, who can make any sense of it? And doctors love taking pride in putting patients in their place. Oh, you went to Dr. Google? What do you understand? That's not right. I'm the doctor. I've been practicing for so many years. I've spent so many years in medical college. So don't ask me all these stupid questions. Just leave everything up to me. Now, if doctors could guarantee you 100% pregnancy rate after IVF, I'd say more power to them. Please don't ask any questions. Switch off this video. But the fact is, we can't. And that's why you need to know what's happening. So let's start from the basics. Ovulation is a simple physiological cyclical event which is the heart of the menstrual cycle. That's why women menstruate. And that's why girls don't, because they're not ovulating. And that's why menopausal women don't, because they're not ovulating. So from the point of menarche, which is the first menstrual cycle, all the way up till menopause, which is the last menstrual cycle, women produce an egg every month. That's called ovulation, or these are ovulatory cycles. And when the egg ovulates, which happens inside the body, so there's no way of making out what's happening. But women who are sensitive and aware will get a little pain called Mittelschmerz, they'll get cervical mucus, and it's possible to track this. There's a calendar method, for example. You ovulate 14 days before your next menstrual period is due, so it's possible to calculate what your fertile time is. Suppose you don't ovulate. That's called anovulation. Now this could happen because you've run out of eggs. It's true for menopausal women, or you have a medical problem, for example, polycystic ovarian disease. For these women, we need to make them ovulate, and that treatment is called ovulation induction. We're inducing ovulation. It's usually easy to do this. In the past, the standard workhorse was clomiphene, which people still use, but it often has an anti-estrogenic effect, which means the endometrium is sometimes thin or the cervical mucus dries up. So we use an alternative called letrozole for ovulation induction. Tablet, not expensive, easy to take, easy to monitor. And you don't have to monitor every cycle. Once you've shown that you're ovulating, then you can assume that that same dose of letrozole will help with the next cycle as well. And if you want, you can monitor ovulation with what are called ovulation prediction test kits, or OPKs, which are simple urine tests. And you want to find out how to do them, please visit our website at www.drmalpani.com, or you can monitor using ultrasound scans, whatever works for you. So much for ovulation induction. Now suppose you have a woman who's ovulating and still not getting pregnant. Then one of the things which doctors do is called superovulation. As the word suggests, we're helping you to ovulate more than one egg or more than one follicle, preferably 2 or 3. Not too many, because if you end up growing too many follicles and too many mature eggs, you increase your risk of a multiple pregnancy, and that's not a desirable outcome, no matter how cute twins may look in movies. So with superovulation, again, you can use medicines, and if that doesn't work, or you need to get more aggressive, you can use injections. These injections are called gonadotrophins. Again, long name, but quite simple. Gonads are ovaries. That's where the eggs are produced, and trophin is you're nurturing them. And these are natural hormones. And your body does this normally, and if we need to make it work better, superovulate you, we use these hormones. You can extract them from the urine of other women. Those are called urinary gonadotrophins, or these days we can actually make them in the lab using DNA technology, what is called recombinant or rec gonadotrophins, recombinant stuff, which are more expensive, and they work equally well. So much for the tablets and the injections which can be used for superovulation. But again, superovulation needs to be monitored. How does superovulation help the infertile couple? It helps to increase your fertility because obviously if you're growing more eggs, the chance of the sperm meeting the egg increases. And lots of doctors will combine the superovulation with intrauterine insemination or artificial insemination to increase the chance of the eggs and sperm meeting. And if that doesn't work, then we need to do IVF. And again, with IVF, we can do what is called natural cycle IVF or mini stimulation, where there's just 1 or 2 follicles. Or the standard IVF protocol involves superovulation to give you a much higher dose of injections to make you grow lots of follicles or lots of eggs. That's again called superovulation, but the goal is different. With IUI, you want 2 or 3, not too many. With IVF, you want a lot more. What does a lot more mean? You don't want 25 or 30, and I'll come back to that, why you don't in a minute. But your optimal numbers tell 10 to 12 to 14 follicles, and you can track this on ultrasound, and that's where it's so important to have a good doctor. Someone who checks your antral follicle count, someone who checks your AMH level, someone who checks your past history, has a lot of experience, decides what the right superovulation protocol for you is, and there are many combinations available. And that's the difference, good IVF doctor and someone who's not very good, because a good doctor will tailor the superovulation protocol based on your ovarian reserve, your ovarian response, and we're extremely good at doing that. And that's really what makes us so successful. So much for what is called superovulation. And as I said before, there's a sweet spot, there's an optimal number, because what you want is an optimal number of mature eggs, because you get these eggs which are mature, you take them out, you fertilize them, make embryos, and then transfer them back one at a time after freezing the extra embryos. One thing to remember is superovulation will not make you run out of eggs. Please understand this. A lot of women are scared. The doctor's giving me all these injections, hormones, side effects. Not only am I worried about the side effects, if every month he makes me produce 10 follicles and 12 follicles, then won't I get menopausal faster? And you won't. Because with superovulation, we're only saving the follicles which would otherwise have died anyway. Let me explain this. Every month, every time you start a menstrual cycle, about 40 follicles start to grow. Of these 40 follicles, 1 will become mature. That's called the dominant follicle, which will ovulate, and the others will die because this dominant follicle will cause them to get suppressed. When we do superovulation, we're stopping these other follicles from dying so that they grow along with the dominant as one as well. That's why we get you to grow multiple mature follicles. We're saving the follicles which would otherwise have died. We're not going to make you run out of follicles. Trust me, you're not going to become menopausal any quicker because of doing IVF. So you can rest assured the hormones are safe. The procedure is safe if it's done well. Will not affect your future fertility. But if it's not done well and you end up growing too many follicles, that's a problem. And that's when you end up with what is called hyperstimulation. Hyper means too much. Hyperstimulation. The proper word is ovarian hyperstimulation syndrome, which can actually be life-threatening, especially when doctors don't know how to deal with it, and lots of them don't. They get very excited when you're growing so many follicles, and you get so many excited. So many follicles, so many eggs. But this can come back to bite you, because if you end up with hyperstimulation, you may end up in the ICU as well. And some patients have been known to die because of hyperstimulation. So the bottom line is, understand these words. They're not very complicated. And you should understand what's happening, because that way you will be an equal partner in your treatment, and you'll know exactly what your doctor is doing and why. It's in your best interest and the doctor's best interest that you do that as well. Lots of information on our website about hyperstimulation, how to prevent it, how to identify it, how to treat it, how to choose the right superovulation protocol for the right patients. So patients with poor ovarian reserve, patients who are older, need a different superovulation protocol from someone who's younger or someone who has PCO. And you want to find out more, please visit our website. There's tons of information, over 1,000 pages of information on IVF. Still have more questions? Ask me a free second opinion. Free, no strings attached. We have a free second opinion form on our website, and I'm happy to answer any question you want. And we look forward to helping you to have a baby. I look forward to seeing you digitally, or you know what? You want to come to the clinic? Please do. COVID-19 or no COVID-19, we're back to work, and I can promise you that you will not get better medical care in any other IVF clinic. And I can assure you that if you're well informed and you choose the right doctor, like us, you're maximizing your chance of getting pregnant. What else can an infertile patient do more than that? Best of luck.